We welcome you back to In Focus, and we're joined now by our In Focus health correspondent, Linord Moudou, and she has some interesting news for us about several widespread diseases in Africa. Linord?
Hello, Dimiake.
Hi.
Hi. Well, the Organization of African First Ladies Against HIV/AIDS, OEFLA, recently elected Zambia's First Lady, Thendiwe Banda, as the new chairperson during their 10th General Assembly in Equatorial Guinea. Officials say African First Ladies are joining forces with those responding to the HIV/AIDS epidemic in Africa and have mounted a war against the disease. Zambia takes over from Ethiopia for OEFLA's leadership. Members of Nigeria's Sickle Cell Advocacy and Management Initiative, or SAMI, want the government to introduce a healthcare policy for people living with sickle cell disease. The organization creates awareness of the condition and provides support for victims. Sickle cell disease is an inherited blood disorder affecting red blood cells and can cause pain, strokes, organ dysfunction, and premature death. The disease affects 3 to 5 million people globally. Members of SAMI say many Nigerians can avoid future health complications if more information is provided to the public. They say it is time for the government to act.
Living with the disease, the federal government and the state governments should do something about sickle cell anemia. Nigeria has the highest number of people in one country living with the disease, and we want people to know about it and to make sure that they do their genotype testing before they get married, so they'll be aware of their sickle cell status.
We should have a health policy, health management policy. People cannot afford basic medication on sickle cell, for sickle cell, let alone even their hospital admission. So we should have basic health policy towards it, like they have with HIV and malaria.
And experts say that the sickle cell threat can provide an advantage in areas where malaria is common. They say that sickle-shaped red blood cells are less likely to be infected by the malaria parasite. There are literally billions of cell phones in use around the world today, and now one Israeli researcher has found a way to use them for combating one of Africa's most lethal diseases. Alberto Bilanca is with Israel's Ben Gurion University. He says the innovative system he has created is non-invasive and enables any person with a cell phone to rapidly detect malaria. The system uses a cell phone's imaging system to detect malaria parasites in the blood.
Basically, you have to hold the cell phone and image the tissue you would like to test. And by looking at the blood flow and at the malaria pigment images, hopefully you will be able to diagnose and monitor the severity of this terrible disease.
The World Health Organization says 1 in every 5 childhood deaths in Africa is due to malaria. In his university lab, Bilanca has built a working prototype of his device. The researcher plans to conduct large-scale field tests on animals and humans within a year to prove the system's feasibility. Alan Warburg, an expert with the Coven Center for the Study of Infectious and Tropical Diseases at Jerusalem Hebrew University, says this approach will be very important in combating malaria in Africa.
And this means, as would be very obvious to anybody in Africa, that when you come to a rural clinic, anything up to 90% of the cases would be malaria. Diagnosing them now requires a drop of blood from a finger prick, microscope slide, fixation, staining, and examination by microscope. This takes time and takes professional knowledge of how to do it. What this technology will enable will be for a person to obtain the same data within a minute or less.
Bilanca says the cost of the complete system will be similar to the cost of a standard cell phone. He expects to begin manufacturing the device within 4 years. His research team was awarded over $1.4 million by the Gates Foundation, the European Union, and other funds to pursue its development.